Hello everyone, it's Schematic Med, and today we're going to talk about Potter sequence. If we remember from our embryology classes, a sequence is abnormalities result from a single primary embryologic event. In this case, it will be Oligohydramnios and Potter sequence. This term is named after Dr. Edith Potter. She analyzed approximately 5,000 autopsy cases performed on fetuses and newborn infants over a period of 10 years and found that 20 of these infants presented with bilateral renal agenesis, all of which had distinctive facial characteristics. Before we start talking about the mechanism how this condition occurs, I want you to pay attention to these pictures. In this picture, we can see a foot binding process, which was a traditional practice in China, particularly among upper-class Chinese women, aimed to achieve small pointed feet known as golden lotus. The process involved tightly binding the feet starting in childhood, resulting in deformities. The practice persisted for centuries due to cultural ideals of beauty and femininity. And in this picture, we can see a watermelon. In Japan, square watermelons are grown by placing young watermelons into square containers. As they grow, the fruit takes on a square shape, making them more convenient for storage and transportation. The practice is a novelty and originated as a way to prevent the watermelons from rolling. So I hope you understand why I'm talking about these two pictures. It is the same mechanism that happens here we will see in the fetus. So when we do not have that much space to grow, we cannot grow fully. So we will have some deformities, we will have some problems, anomalies and health issues. So right now, let's start understanding what Potter sequence is. In other words, we can call it Oligohydramnios sequence. Oligo means low, hydramnios means amniotic fluid. This condition occurs during pregnancy and is characterized by a lack of amniotic fluid in the amniotic sac, which again we call oligohydramnios. Amniotic fluid is crucial for the normal development of the fetus, including lung development and preventing compression of the umbilical cord. So we all know that most of the part of the amniotic fluid is urine. So what we do, we swallow the amniotic fluid, and it is not like only we swallow it, some part of that amniotic fluid we aspirate, and it goes to our lungs and it stretches them, and that helps our lung to develop. So right now, it is very logical when I say that this condition is associated with bilateral renal agenesis. The important word here is bilateral, because if it is unilateral, the other kidney will work fine. Agenesis means the kidney fails to develop properly. Or other condition, again bilateral multicystic dysplastic kidney disease. Let's point one more time that oligohydramnios is a trigger, so this condition will occur. Without functional kidneys, the fetus is unable to produce urine, leading to reduced amniotic fluid levels. The lack of amniotic fluid can then result in various physical deformities in the developing fetus, including limb deformities, facial anomalies, for example, low set ears, retrognathia, flattened nose. Additionally, the compression of the chest and the lack of amniotic fluid aspiration into the fetal lungs can lead to pulmonary hypoplasia. We already talked about this. This last point is a significant cause of death in cases of Potter sequence. Additionally, Potter sequence may be caused by chronic placental insufficiency. It is logical if less blood is coming, we will not have enough blood to filter with the help of the kidneys. And conditions, very important point, conditions contributing to reduced renal output, including autosomal recessive polycystic kidney disease, ARPKD. Why it is not dominant? Very, very, very easy answer, because recessive we see during infancy, and the mnemonic is that if it was DADPKD or autosomal dominant polycystic kidney disease, the D is for adult. We see that condition during adulthood. And next very important cause will be obstructive uropathy, for example, in male fetus posterior urethral valves. Thank you for your attention. Bye.